So, Kathlyn and we both went into our internship and clinical rounds with Clinicians Incubator, and we were in basically our first group introducing ourselves until I don't even know how long through the program, like what, almost 2 years, a year and a half.
I think I was in it for a year and a half.
Right. So we were in every single group clinical round together. And we basically just became also study buddies for our boards and trauma bonded over that. Super fun.
Yeah.
Good times. And we took our exams and our boards on the same day
Yeah.
and both passed. But yeah, we just really became friends through that and have honestly just worked together since, and the rest is history.
Yeah. So a lot of people don't know to become a board certified nutrition specialist, you have to have 1,000 supervised hours and pass a 200 question board exam. And so that's kind of the process that Rachel was explaining that we went through. And we were grouped together in every group for 2 years. We studied together. And I think something that we really bonded over was that we both really were passionate about women's health and saw our businesses heading in that direction. So it also helped us help each other. And both starting your own business is really challenging and lonely. And so it was really nice to have a colleague to consult cases with each other when you're still learning the ropes.
Right. And then I believe, were the one who brought the idea to me about starting this and collaborating on it. And so we both have like different strengths when it comes to like women's health and what we see. And so we decided it would just complement each other perfectly. So we were like, why not just build this program together and offer it to women to help them understand their body and hormones better?
Yeah, so our program is called Cycle to Conception, and it was brainchild truly out of the work that we've done with clients for the last 3 years and the trends that we've both been seeing and talking about with them, but also in our personal lives, and all the information that we've gathered throughout our master's degrees, internship, board exams, and then clinical practice to figure out what do women actually need to optimize their reproductive health.
Yeah, there's so much information out there that it's confusing. And we also know that not everyone can see us one-on-one. So by doing this, we want it to be more accessible and also build a community where you're not in this alone and then there's a group of women supporting you.
Yeah, and I think something that's really important to note is that in this community, it doesn't just have to be one group wanting the same outcome. I think whether or not you want to conceive or not, you might be experiencing a diagnosis or symptoms or just not feeling right in your body. And the anxiety that that brings up, whether it's because you're worried about conceiving one day or you're just worried about your health, is really challenging. And having, of course, professional support, but also community support of women who are experiencing some of the same worry and feelings as you is really, really crucial.
Right. Because we've both been on our own journeys. And so we know how isolating it can feel. And whether your goal is to have a child or whether, you were diagnosed with PCOS or endometriosis, whatever it may be, it's just knowing that there are other people there that are going through a similar path, whether it is exactly like yours or not.
Yeah. And it's actually really, I don't want to say funny, but for whatever word it is, that I actually had Rachel on my podcast. We recorded the episode probably like end of 2023, beginning of 2024, and then it came out in 2024. And around that time, I was actually diagnosed with PCOS, and the episode was about Rachel's story with PCOS and endo. And it was like really comforting to have a friend and also already know her story and the positive outcome that it had when I was diagnosed in 2024, because I think maybe I have other friends now, but at the time, Rachel was like the only friend I had that had experienced that. And so it took some of the initial anxiety out of a diagnosis.
Right. Because when I was first diagnosed, and even before I was officially formally diagnosed, I didn't really know anybody with it. And so it's kind of like this isolating path where you're like, what is this? Am I the only one that has this? And I think people talk about it more now, but sometimes it feels like it still is a little bit more taboo that people still don't know what it is and they don't understand.
Yeah. And Rachel hinted at this earlier, but we both have our own strengths and weaknesses, and it really does come out of our client base and who we've been working with for the last 3 years. It obviously makes you more of an expert. And so Rachel has seen a lot more clients with PCOS and endometriosis, and I've seen a lot more clients with infertility or secondary infertility or difficulty conceiving. And a lot of times it is lack of a diagnosis of those issues, but there's also so many other factors that we consider that sometimes other professionals don't, that we cover in cycle to conception.
Right. We really look at the foundation and the root there. I mean, that's a lot of why a lot of what we were seeing in our own client base is kind of also what made us want to do cycle to conception because there are so many patterns that we've seen, right? I know you see it, I see it. We see women that come to us that are exhausted and frustrated and confused because they're told that everything is normal and that what they're feeling is common and they're not given, proper information of like, this is what you should do, or you should eat more of this, or X, Y, and Z. It's given like this band-aid solution of exercise more, don't eat carbs, lose weight, which is frustrating because oftentimes so many of these women are already doing these things and they're actually working against them, not for them,
Yeah.
instead of giving them tools that are actually going to help, right? They've been dismissed by probably multiple providers. And so that's where we come in. And oftentimes we see clients that have exhausted those options and then come to us because they're really looking for a new approach.
Yeah, and it's kind of what you said of we see a lot of the same symptoms over and over again. I have a like hormone health, reproductive health, like little questionnaire that I'll ask clients to see if like a Dutch test or further functional testing is necessary. And it's amazing how many things come up as like yes, from fatigue, hair loss, PMS. Pretty much everybody says they have PMS to some capacity, some more extreme than others. And then as you work with clients and talk to them more, like more and more little details pop up that they don't even know are signs and symptoms of a hormone or detox need or another symptom of something else going on.
Right. There's like a missing piece of the education component and also just support. Because what someone wants to hear is what you're feeling makes sense. And this is how we're going to go about getting to the root of it, not just do X, Y, and Z and come back in a year.
Yeah. So I think that that is part of what sets our program Cycle to Conception apart from other programs out there is that we're not just giving you a ton of information with the goal of you to work with us afterwards. Obviously, we would love it. I would love to continue to support you, but we know that sometimes that's not always accessible via financially or time. And so our goal is to actually give you steps to deeper understand what's going on in your body so that you can go to your doctor, to your OBGYN, to your functional practitioner that you might already have and say, these are the symptoms, this is what they're correlated with, this is the information that I have of potential solutions or potential tests, like what can we do next? Instead of, like you said, the classic, like, wait another year, just take this supplement, your labs look fine, that a lot of women who end up coming to us have heard before.
Right. And I know you've had this experience and I have, and we've worked with a good handful of women at this point that have gotten pregnant who were told that they wouldn't be able to get pregnant without IVF or, different interventions, which sometimes is still necessary, but they weren't given information on things that they could do to support their bodies, and they also didn't understand their cycles.
Yeah.
And I do always feel like there is that missing component of a lot of women don't know and understand their cycles.
Yeah, I think a question that we've gotten from followers and friends who are curious about our program is like, what do we expect to see like women shift or have improvements in by the end? And I think first and foremost is understanding their own bodies and their own cues and what their body is telling them. Your symptoms are not a mistake. They're not an accident. They're your body's way of saying that something is a little bit off. And so, how can you better understand your digestive symptoms, your skin issues, your symptoms around your cycle? Not only like the negative ones, but also some of the positive ones. So you're like, if you're having good cervical mucus, if you are having ovulation every month, if you're having normal cycles, like there's so much that your body can tell you about what's going on by just knowing what to look for.
Right? Cycle literacy is body literacy, quite literally.
Yeah. And I think it is a testament to what we're building is that we don't want anybody who has previously felt dismissed or confused before by potentially practitioners not answering their questions or them seeing information on the internet that is conflicting and not knowing, should I do this? Shouldn't I do this? Rachel and I have joked that you can find an argument that everything is good and everything is bad.
It's true. Yeah.
So we kind of break down the why that is throughout the program. Like, why is something good for some people, but maybe not as beneficial for others, and provide a lot of the clarity around that, as well as really get into the nitty-gritty stuff that sometimes other providers don't have time for.
Yeah. Because unfortunately, most appointments are dictated by insurance. And also, I always say when people come to me about why didn't a provider say this to me, you don't know what you don't know. And you and I have had extensive years of like education and clinical hours, and we know in depth about this through personal journeys, but also through our education and continued education and everything that we've been building and doing with clients for the last few years.
Yeah. I mean, just a perfect example of that is literally yesterday, I was talking to a potential new client and they were just diagnosed with anemia. And I was like, well, the first thing that you need to do is start pairing iron foods with vitamin C foods. And then if you decide to work with me, we can get more in detail, but that's like a really tangible, low stakes piece of advice that I could give. And they were like, why didn't my doctor tell me that vitamin C increases the absorption of iron? And it's just like simple little tricks that to us is like obvious,
Right.
but sometimes it's not the priority for others.
No. And that's why we're here and exactly what we're doing and building.
Yeah. So we also got a question of what thing we wished every woman knew about their reproductive health. And as we've been building out these modules, sometimes I feel like it's very repetitive. And it's that building your foundation is actually quite simple. The same things are recommended over and over and over again, whether you're wanting to support your hormones, your gut, your liver, your mental health. the basics are the basics no matter what. So are you eating nourishing foods? Are you depleted in any nutrients? How can we replete them if you are you sleeping enough? Are you managing your stress? Are you having good poops? Like that is universal. And I think sometimes we can get really caught up in what's on the internet. But truly, the thing I wish everyone knew is that it doesn't have to be hard.
No, I think you said that perfectly. We overcomplicate things and think that we have to try this new trend or whatever's out there, a new blend, supplement, all of these things. But you're just adding, it's already causing stress. It's basic necessities, right? Your basic needs need to be met. And that is oftentimes where I see it, and I'm sure you see it also, that people aren't doing that. And that is where there's a huge disconnect.
Totally. Is there anything different that you wish women knew about their reproductive health?
I think I touched on it a little, but I think that really is, I always keep going back to that cycle literacy is body literacy. I just think that women understanding their cycle, right? So understanding it's so much more than a period. And I think that a lot of us, like if I wasn't in this work, would I really know that much more about my cycle? I don't know, right? Like obviously we know a lot now, but before I got into this, before I went back for my master's, I wasn't sitting there thinking about every little thing about my cycle, each phase, what foods support what. And I think just understanding that and understanding why your energy shifts and your mood shifts, why you sleep differently, understanding that and how to support those changes throughout each phase of your cycle is, I think, what I would say I wish more women knew about their cycle. Because to us, again, we think it's common sense, but we're in this.
Yeah. And
And so many women don't.
I agree. And I think a lot of people don't know like everything that's involved in the cycle. Like most women know about estrogen, but there's also progesterone, FSH, LH. They know that their period, when they actually physically bleed, is a sign, but have no idea about their cervical mucus, that their cervix actually changes position, that their body temperature changes throughout the cycle. And exactly like you said, their needs change. And I think if we can get women to better understand just their own body, that's huge.
Yeah, it is because it's also, it gives you an ability to advocate for yourself more in appointments. Because when you know more about your body too, and you know about your cycle, you feel more confident to walk into a provider or whichever appointment you're going into and advocate for yourself because you know. And you always know your body best. And so just having these tools and information is huge in that. It gives you more confidence.
Yeah. And honestly, that's probably why it took one visit with my OB when I said I think I have PCOS to get the diagnosis because I had so much knowledge. And I was like, here's all the reasons why I'm 90% sure that I have it. Can you confirm? And they're like, yeah, easy. I never felt dismissed. One, I think my OB is just really wonderful. But two, I think it was also coming with such like stacked list of reasons why and not just saying like, oh, my periods are irregular or I don't feel great on my period, but like knowing and having that information really helped. And I think that's also why within 1 year, I was able to alleviate pretty much all of the PCOS symptoms that I was having and get pregnant.
Right. And so, and that is a testament to knowing. And see, for me, I did not know when I was younger. So for me, I took multiple providers and also, I don't even know how many years, like 7 years to get a diagnosis. And so, and honestly, like that's how it is for so many people. But by the time that I got my diagnosis, I already kind of knew that I had it. And so when I went in, I also have a great OB, so she's amazing. But I knew what I was talking about and I went in with the facts and they did the testing and sure enough, got the diagnosis. So walking in, knowing your body, knowing your cycle, it helps.
Yeah. And I posted on my story maybe a month or so ago, talking a little bit more about cervical mucus and my experience of learning about the Creighton model which is basically a scientifically backed model for interpreting your cervical mucus. And a lot of people, especially my friends who I talk to like in depth about this, were like, how did I not know about this? Like, why did I never really understand? I think a lot of women have heard of like, or know about discharge, not heard about it, seen it,
Right.
know about it, but not know about this huge marker for a healthy ovulation. And women stress so much about with their whether or not they're ovulating, especially with the popularity of like LH strips. And while they can be a good tool, I personally don't think that there's a better tool than what your body's already telling you.
It's so true. I think that there's like this lore behind cervical mucus because it really is like one of the clearest signs of where your hormones are when you know what you're looking at. It's like, okay, we know if it's like egg white and stretchy, you're probably in your fertile window. And there's all these different ways to look at it.
Yeah. And it's one of the only ways without like medical intervention and like an ultrasound to 100% confirm that you ovulated.
Right. I think it's the biggest green flag.
Yeah.
It is. Yeah.
Yeah. So, anyways, these were just little bits and pieces of our story and our why behind cycle to conception and answering a few questions that have come up as we've started to talk about it and promote it over the last month. And we really just hope that you want to join us for our first cycle to conception collective, our first group, our pilot of this program. It's something that we're really proud of. And every single time we finish a module, it also comes with a resource guide, handouts, a ton of information. And I just get so excited because I know it's going to positively impact so many women.
Right. And also noting that a lot of what we're talking about in these modules are things that we have both done. So it's not just things that we're telling you that we've never done. We've both done a lot of these things, and these are foundations that we use, and a testament to like my symptoms of PCOS and endometriosis being pretty non-existent at this point, which is great. But also during this, I'm going to talk about it because she's not going to bring it up. But Kathlyn got pregnant during all of this. So, like she was living her lifestyle in the exact same way that we're talking about this, whether that is your goal or not. But it's just a testament to the foundations of this, right? Because you do have PCOS, and I'm sure it was a concern for you, the fertility side of this. So it just is a testament to like that these basics and the foundations and everything that we're giving you does work.
Yeah. And I love that you said that because now my brain is like, okay, yeah, in module one, of course, module one is all about nutrition. So, like, obviously, our bread and butter where we thrive. So, of
Right.
course, we've implemented so many of those, nutrition based advice. Second one is about micronutrients, so vitamins, minerals, and other key nutrients. And it was honestly hard to narrow down some of the extra nutrients. Of course, we included all the vitamins and minerals, so you'll have that. But what other ones to choose from because we have utilized so many to support our reproductive health. The next module, we go over like lifestyle choices and the best things that you can do for your body to manage stress, to move. And Rachel and I are both certified yoga teachers. And so that is something that we've implemented in our own life very much. The fourth module we've completed is all about tracking your cycle and cycle syncing. And I, before I was a nutritionist, when I came off of hormonal birth control, that was the first thing that I learned about. And then I'll just say one more. Module 5 is all about environmental toxins and cleaning up your space. And again, that was kind of one of the first things that I did before I got into all the nitty gritty. But then as I got into the nitty gritty, that's when I started to also look into things like parasites that I know are getting a lot of attention right now. So we really are taking all these things that we've learned about and implemented and It's not as challenging as it seems, but it does take time.
Right. And so the way we are doing it is we're not overloading you. We're doing it in a digestible way so that you're able to look at this and you're not feeling overwhelmed and can take pieces of this. And you can use this. You're going to have all this information. And so you'll have this to use for forever after this, essentially. So it's really just something that you're going to use through different phases in your life. And it's a really great tool to have.
Yeah, and we use the coaching techniques that we've learned to help you implement small things. So at the end of each module, there's homework. It's not really homework, but it's more of like goal setting. And it's small. It's like one thing from the module that you're going to implement in the next week and see how it feels. So it's realistic, it's actionable. And by the end of the 9 weeks, you'll have made anywhere between 9 and however ambitious you're feeling changes in your own life.
Right? Yeah. And if you're not sure if this is right for you, reach out to one of us because we're happy to get on a phone call with you and talk about it and see if this is the right fit for you or not.
Yeah. So thanks for considering joining Cycle to Conception. We absolutely cannot wait for January 7th to kick off with everybody. And until then, we'll continue to share what we're building and a couple of surprises along the way.
I'm excited.